One.
Hi, I'm Katie Dabrowski with Oval Athletics, and we have Hannah Sadowsky here, who is our physical therapist, strength coach, gymnastics extraordinaire. And we're going to talk a little bit about what her background is, how she blends strength and conditioning and rehab and gymnastics in with all of her clients and patients, and some topics in gymnastics that can apply to us, can clear up some misinformation or misconceptions that exist, and just help you understand a little bit more about how integrating gymnastics into strength training, no matter who you are, can be extremely valuable. So Hannah, can you tell us a little bit about your background and your experience and history with coaching and things like that?
Yeah, so I'm super happy to be on the podcast this week and talking about what I love most, gymnastics and physical therapy. So a little bit about myself is age of 6, started gymnastics, kind of everything blew up from there. I was a gymnast up until the age of 17. I started coaching gymnastics around the age of 15, and as I got into undergrad, I coached all levels, anywhere from 1 to 10, compulsories, optionals, everything in between, and from there, it kind of led me to my career path as a physical therapist. So as you may or may not know, a lot of times gymnasts get thrown under that bus of it doesn't really matter if you're hurt, you're going to keep training. So being through that lifestyle, it kind of guided me to really know what I wanted to do with the rest of my life, and that is being a physical therapist. So I kind of took it and ran with it. I continued coaching, and I actually still coach a little bit now through undergrad, grad school, and then once I graduated as a PT, started blending those two worlds of physical therapy and gymnastics and trying to just educate the culture of gymnastics and really get them on board with kind of an understanding of where we should be now versus what has been ongoing in the past.
Yeah, and I mean, it's a sport, like many sports, that I feel that there's probably just a ton of misinformation, a lot of potentially mismanaged injuries, maybe lack of exposure to strength and conditioning, things that I know you implement in all of your care. So can you talk to us a little bit about like what your pillars of patient care are? Like what fires you up, what makes you really passionate about delivering the level of care to every person who walks in who probably hasn't experienced just what you do ever before? Like what are those things that you really incorporate?
Yeah, so I actually get very excited to kind of mention some of these. My patient care pillars are going to be what we've said multiple times in the past, patient-centered. So really getting to know an individual and providing them a plan that works for them. And I think one of the biggest things is putting it on paper and then actually executing it. So it's really easy to tell someone what you want to do with them and where they should be. But I think the in-between part of actually executing it and getting them there is the piece that can be tricky or challenging. And so really focusing on the patient and bringing positivity into all sessions, because harping on negativity is not where you're going to see good results. Pulling in positivity and small wins or small successes are some of my pillars at the top that I make sure in every session I can achieve. And if I don't, coming back in and seeing what I can do a little bit different or a little bit better to really achieve those things and get good outcomes.
Yeah, and that's awesome. I think so many people, regardless of coming from gymnastics or any of the performing arts sports that you work with, I think the co-creation of a plan is so important in physical therapy. It's often people come to us and say that maybe if they've had physical therapy before, they didn't even know what the plan was. And it was just kind of confusing, and there wasn't really any milestones to hit or anything that they could tell they had progress or they could tell they were getting closer to their goals. And so that's huge. And then also co-creating it, making sure it's something that works with your patient as well. You have kids who are up at 5 a.m. to see you before practice, before school, and that's a really difficult and delicate line to tread to make sure that you're giving them what they need and you're helping them manage load and manage things safely and not overdoing it, but also not underdoing it, because what are the forces of times someone's body weight when you tumble or flip or do?
It is out of this world. For the ground reaction forces, just from punching the floor one time is anywhere on average from 6 to 14 times your body weight. And if you consider a tumbling pass, just one tumbling pass, they typically do 3 elements in that pass. So a round off back handspring and then some form of flip that's usually a lot higher, meaning the forces are gonna go up. So that's already 3 to 4 contacts of that 6 to 14 times body weight. So it's a lot to handle.
And how many times do you get somebody coming in, a gymnastics athlete who has never strength trained before, yet they are exposed to 6 to 14 times their body weight when they're doing their skills?
That's actually the most common thing I tend to see is not that the gymnast is injured because of some traumatic injury, but typically from an overuse that is because of a lack of strength, but a repetitive overdoing of skills that they're not quite prepared for because the forces are just so high and their strength training does not replicate those forces whatsoever.
Yeah, that's huge. I mean, there's so many things that even just in everybody's day-to-day life, walking, running has exponential forces through our joints beyond our body weight, but flipping and tumbling and running and landing over and over and over again, it's just out of this world. So what are some things about being at Old Bull and being able to serve the clientele that you're able to serve here? What are things that are different about what you get to do with a young gymnast who walks in the door and you're able to really help their path of understanding potentially their injury, understanding the importance of strength training, understanding what this looks like, and it's a long game, it's not a quick fix. Like, what are some of your skills that you're able to do at Old Bull?
So it's great to be in a facility like Old Bull because we have such a wide variety of equipment. So typically in your gymnastics gym, you tend not to see any weights, which that's kind of where the problem stems from. And so when I do have gymnasts come into Old Bull, we have access to all sorts of kettlebells, which those are like top in my book of exercises because they're so versatile. But not only that, we have things like rings. And if you take a female gymnast who doesn't have rings as one of their events, they've never been on rings. And it sounds crazy, but they have access to them maybe in the gymnastics gym, but they're not typically utilized. So being able to create and build stability from maybe a similar exercise, but different piece of equipment, is what I get to do here at Old Bull.
Yeah, that's awesome. And believe me, if you've walked into Old Bull and you've been seeing Hannah work with any client, you see somebody just hanging upside down, doing crazy things, or running and jumping and tumbling in the space. It's pretty awesome, and even just being here and witnessing it, it's so cool to see. And I mean, so of course you work with gymnasts, of course you work with these young athletes who are out of this world strong, so incredibly talented. How do you incorporate gymnastics with anybody that you work with? Because you don't only work with gymnasts, you work with a lot of people. How do you incorporate some of those skills that even if somebody's not competing or they're not necessarily coming here as an athlete in the performing arts, what are some things that you are able to do to help anybody learn gymnastic skills?
Yeah, that's a good point. Not everyone I see is a gymnast, and typically I love to introduce those types of calisthenics or gymnastics-based skills to really anyone because it gives them a bit of self-confidence. They never thought in a million years they would be able to do what's quote-unquote gymnastics skills or calisthenics, and so to be able to bring that into their day-to-day training life is pretty cool. But anything that involves movement of the body, being able to hold your own weight up and move it through time, space, air, whatever you want to say, is where I start. So whether that be a static kind of bear crawl hold, whether that be a static bear crawl hold with one leg out, it can all be a progression into front levers or back levers or pull-ups, push-ups, single leg squats. All of those can be regressed or progressed to fit anyone's training style. And so when you start bringing that into realization for someone, they think less about doing gymnastics and more about reaching an attainable skill, and then down the road it progresses and it becomes pretty cool, and then they turn with a gymnastics skill.
Yeah, that's a really good point. And it's almost like you're gamifying rehab and training as well. because some of gymnastics stuff is just fun. And
So
being
fun.
able to not only move weight, like we have plenty of weight to be able to move here at Old Bull. Being able to move weight is obviously important, but being able to move your own body through space, like you said, and control your own body and feel in control of that is huge. And talk about confidence boosting and autonomy for anybody who might be struggling with pain or injury. I mean, being able to help people realize that they can move their body, they can trust their body, they have stability, that's huge.
Yeah, I had one particular person comes to mind with that, in which they had tons and tons of knee pain, never thought in a million years they would be able to squat, let alone single leg squat. And throughout the course of the rehab, which turned into training, they managed to get a single leg squat, and a few months down the road told me a story that they slipped and fell down the stairs holding their baby, and one of the only reasons they did not fall along with their child is because they were able to slowly single leg squat down and brace the fall. So when you put it like that, that's another fantastic reason to be kind of training and working and incorporating these gymnastics or bodyweight skills into a typical program.
Yeah, that's awesome. Yeah, anytime that we can have a skill that you learn in the gym apply to what you're doing outside of the gym is huge. So the world of gymnastics, I imagine, and I know that you and I have had a lot of conversations about this, or even when we're debriefing over maybe a new evaluation that you've had, there's a lot of misinformation, a lot of myths, a lot of things that I think probably make it challenging for you as a therapist to help undo some of the things maybe in terms of like parent expectations or even athlete expectations. What are a couple of the most common things that you see that you kind of have to undo and help educate and communicate with people to better understand, like, okay, this is actually what we're going to focus on, or what you're thinking isn't as dangerous as you thought it was? What are some of those things?
So the first one that comes to mind is kind of a classic where parents have that misconception of younger kids shouldn't strength train. And that always is a topic at hand that I'd like to, educate right off from the beginning, because it's not the strength training that is the issue with age. And a lot of parents think that weight might be dangerous or any outside training is dangerous, when in reality, that's what's gonna only better their daughter or son. And so kind of taking them through that process of, if they have a good understanding of the movement, which would be that body weight control, and they listen, they're pretty much safe under a supervisor or trainer or someone who's knowledgeable on how to progress strength training, and they can, jump right into that. So I think that would be the first thing, is getting over that misconception of strength training is bad just because they might be young. And let's see, another common one I tend to get is, how on earth are we going to improve at the sport if we back down on training? Because with gymnastics, it's all about the hours you put in and how hard you work. So getting parents and athletes and coaches on board, understanding that training modification may be necessary, or exercise modification or skill modification. There's not only one way.
Yeah.
And when someone does complain about pain, we have to believe them. And a lot of times in that gymnastics environment, injuries go swept under the rug, or they're told to kind of just suck it up, when really we need to listen to the athlete. We need to take what they're saying and modify things and see, okay, if they're here now, how can we help them get here and not complain of pain? So
Yeah.
Those are two of the most common ones.
Yeah. And with helping a parent maybe understand why strength training is valuable for a gymnast, do you talk to them about what you were telling us, like the 6 to 14 times their body weight is going through their joints when they're doing skills on the floor? Do you talk to them about that? Is that something that kind of helps them understand, like, oh, we need to build some muscle here to make them able to absorb these forces and produce these forces? Is that like a strategy that's helpful?
Yeah, typically when I mention the numbers, a lot of parents have a good realization, like, wow. I'll usually typically compare it with the forces of running, because running's around 3 to 4, just depending on the research you see, times your body weight. And here we're starting at an average of 6.
Yeah.
So it puts it into pretty good perspective for the parents, and they're at least on board to listen more to what I have to say and get the best plan in place. I also like to work with the gymnastics coaches because there's a tendency to see in the gymnastics world a very strict set of strength and conditioning that they use, and that tends to be the issues we see later on, lack of these other exercises they may not be addressing. So getting in communication with not only the parents and the athlete, but the coach as well is really helpful.
Yeah, to make sure that they're well-rounded and getting exposure to everything that they would possibly need to be exposed to. Because part of it, I would assume, also, just like you would be training anybody, you want to build robustness, you want to build resiliency, you want to make sure that they're being exposed to all of the things in life and getting stronger at all of the things, and not only, it's not like a magic exercise for a gymnast, they just need to be well prepared and strong and capable. So one of my favorite things to witness when you're working with some of these young athletes is you have someone who comes in who's like non-weight bearing in a boot, and you're still able to figure out how to do things with them that are gymnastics related, making it fun, especially for somebody in 6th grade who has an injury and she's bummed out about it. What are some common things that you implement when somebody comes in with maybe like a weight bearing restriction or a cast or a boot or anything like that? What are some things that you're able to do with these kids while they're recovering from an injury, but still working on their overall fitness, working on their overall capacity, strengthening other areas, making it fun?
Yeah, so this gets to the fun side of things. I actually really love getting them on board because they're in a position where they're upset, they're hurt, they can't train the same, and it's for a length of time. So kind of what I'll do is I'll craft what are all the things they can do. All the other limbs, let's say they have a cast on their arm, all the other limbs are functioning well. You're also going to have to be prepared, let's say in 6 to 8 weeks, to do what they were doing before. So that's kind of what's running through my head, is how can we keep these other limbs prepared to handle these 6 to 14 times body weight forces as soon as they come back. And so I can utilize things like chains. I've done that in the past where they can wear chains because maybe they can't hold it. That's going to give them a weight and external load added to them. I play tons and tons of games. We can modify surfaces, so we have an air track here, and that's going to give you a lot less load than the hard floor. And yeah, like you said, I just turn it into a game, taking those couple of functional movement patterns we know so well and making sure we hit those tidbits, focusing on common injuries you'll see after a period of time from being off. So hamstring strains, I'm looking at adductor strains because these gymnasts have like a massive range of motion that they move very quick through. So thinking about all those things and tying them into a session without affecting the injury. I think it's the most fun thing. And then as soon as they get out of their cast or their boot, then we just hone in on that injured arm, and the rest of their body feels good and feels prepared to get back to what they were doing.
Yeah, and I think that's such a missing link of honestly all of rehab, like treating somebody only as the injured part of their body. And when somebody comes in with an upper extremity injury and you're only focusing on that, but they're a person, they're an athlete, they have things they need to be able to do with the rest of their body. But if we're not addressing that and we're taking 6 to 8 weeks while a fracture is healing to not load the lower body or not load the other arm, we're missing huge opportunities to actually appropriately prepare this athlete. So I think that's one of my favorite things to be able to watch you do is incorporate the whole person, the whole athlete, the whole body in what you're working on with somebody. And you're not just treating, okay, they had a fall and they have an upper extremity injury. We're not only looking at that. We're looking at all of the things your lower body still has to be able to do.
Right.
All the things your core still has to be able to do. And I think it's a great message for all of rehab. Like, even if you have an injury in one part of your body, you're so much more than that injury. You have so many other things that you can continue to address and train and push yourself through. We know at this point, continuing to improve your physiology, your aerobic capacity, your muscle mass as you're dealing with an injury, you're healing better, you're getting more prepared, and you're not taking time off for everything because you have one injury. And teaching that to a 7, 8, 9-year-old, like that is powerful, that is impactful. That's stuff that we're trying to teach our older clients now to make sure that they feel comfortable with realizing you have a whole body you can train even when you're injured. And getting a young athlete to understand that is huge. Like that's very, very powerful.
I think too, getting them to understand and be excited when they come in is a huge part of it. To have someone that young want to come to physical therapy is the coolest thing, because they barely want to go to school. They barely want to go to school, or they're upset that they go to practice because they have an injury. So to bring them joy here in the clinic is, I think, the best. They learn things they weren't doing before. They come back stronger than before, and it just gives them an opportunity to grow and learn, and then realize this is what they need to be doing kind of for their whole competitive career or athletic career.
Yeah, that's awesome. Thank you so much for joining us. I'm happy that we got to hear from such amazing expertise in the gymnastics world, but also just how this applies to every single client, every single patient that we're able to see at Old Bull. Being able to individualize things, being able to meet somebody where they're at and make them feel more capable and more resilient than they ever thought they could be. And what an added bonus when you get to do that for a super young new athlete. That's very powerful. So thank you. Thanks
for having me on. This was a blast.
See ya.
See ya.
Cute wave.
Okay.